Greetings to all. Today is Monday, 23rd December, year 2024. Every day we are doing meditation for world peace and harmony. UK time 9:30 a.m., 11 a.m., 8 p.m. Europe time 10:30 a.m., 12 midday, and 9 p.m. Humble request for people from other countries to calculate their time according to UK time to join. Today program schedule: first meditation by Damayanti Singaravadivu Master for 30 minutes. First 15 minutes music meditation. After 15 minutes silence meditation. Today our guest speaker Dr. Sasikala Rajamanoharan Master will conduct self-care means caring for others session. Then after question answer session. Now I will invite the Damayanti Singaravadivu Master to conduct the meditation. Thank you.
Thank you, Siva Mohan Master.
Thank you.
Greetings to all. We are blessed to have this opportunity to do this meditation. Drink some warm water before and after the meditation to prevent dryness of the throat. Sit in a comfortable position, either in a chair, sofa, or the floor. Keep your head upright and your spine in straight posture. Please remove your spectacle if you are wearing one. Interlace your fingers like this and keep them on your lap. Keep your feet crossed like this. Now focus on your normal breath, that is in breath and out breath. You may get thoughts during meditation. However, ignore them and concentrate on your breath again and again. Gradually, your thoughts will lessen. We will do this meditation for 30 minutes, first 15 minutes with music and other 15 minutes without music, silent meditation. Nandri. Masters, please come back to your normal awareness. Separate your hands and put your fingers gently over your eyes. Open your eyes gently in 5 seconds. 5, 4, 3, 2, 1. Clap your hands for 30 seconds and enjoy completing the wonderful group meditation.
Thank you, Damayanti Amma. Now I hand over this platform to Tara Master. Please, Amma. Thank you.
Thank you, Siva Mohan Master.
Okay.
We are all united with the goodwill of the universe. We have done a powerful collective meditation highlighting peace of mind and health. When the meditation we do for ourselves is done collectively, it becomes a social force and has the power to expand at the level of home, street, city, country, and the world, encouraging everyone to engage in such meditation. We also express our heartfelt gratitude to PSSM Tamil Europe, PMC Tamil TV, for providing the facilities. Let us sincerely wish you, Valha Valamudan, live prosperously and make peace, good kindness, health, and harmony in the world. Yeah. Thanks goes to Arundhati Master and Sri Kandaraju Master for this platform. Thanks goes to Siva Mohan Master for the music and Damayanti Master for guiding the meditation. Thanks goes to Anandi Baladasan Master for the flyers too. Now, some information about Dr. Sasikala. She is involved in multiple specialties. As a doctor, she is specialized in HIV medicine, sexual health, epidemiology, and she has graduated in psychology and integrated counseling therapy. She has special interest in problems related to anxiety, stress, trauma, and ADHD. She also enjoys gardening and interior design work. She is involved in teaching Tamil at Savasidantam for small children at Ealing Amman Temple. Thank you, Dr. Sasikala.
This platform is yours.
This platform is yours.
Thank you so much. Thank you for that kind introduction, Tara. And also I'd like to thank Mr. and Mrs. Sasikala Raja for giving me this opportunity. So I'm going to talk about self-care today. So I would like to start with a poem from Tirumular. So Tirumular is a saint who followed Saiva Siddhantam, Saivism. So in his book Tirumandaram, he wrote this poem. So this is about self-care. So I'll just read the Tamil bit first. So Udambinai munnam ilukku andirundhen, udambinakulle uruporul kandhen, udambulle uttaman koyil kondan என்று udambinai yan ஓம்புகின்றேனே. உடம்பினை யான் இருந்து ஓம்புகின்றேனே. So basically அவர் என்ன சொல்றாருன்னு சொல்லி சொன்னார், because there is a divine temple inside my body, I worship and nurture my body. So some of you may agree with that view. And today I'm actually going to look at self-care with a different perspective. So what I'm going to talk today is about self-care means caring for others. So my objectives are, I'm going to explain what poor self-care means and the impact. For this, I'm going to use a client story. So I thought that will make it more comprehensible. So what happens to us during poor self-care, and how and what we can do to improve our self-care. I'm going to use some neuroscience to explain this. So now we will just move on to this client's history. It can be slightly traumatic for some people, but then it is a reality of life, and increasingly it's well known as well. So I think people just have to accept it. So this is a 71-year-old second generation Indian woman. Her parents are first generation immigrants from Kenya. So she actually presented to me. So before that, I just want to say this is not a single case. I just synthesized it using two cases so that I can preserve the anonymity of this person. So she presented to me with low mood, low self-esteem. So basically I wasn't worthy of anything. And her main problem was anxiety. She was feeling constantly on edge. And she suffered with sleep disorders. So these are the main problems, but she had loads of other things as well. So when I saw her in the therapy room, she looked so nervous and anxious. She wasn't looking at me. She just avoided eye contact. So I think the first two sessions, we didn't really talk much. She was just crying. And then she started to open up. So what she said, this is her early life history. So she really experienced childhood trauma. So between the age of 8 and 11, she was abused by 3 men. So 2 men were Indians. So basically her father, he always wanted to help his countrymen. So if there was a new recent immigrant, he will invite them home and provide food and accommodation, and she will call them uncle. So 2 of these uncles, so-called uncles, abused her. And then when she was at the age of 11, she was abused by a local Englishman who was their family friend. So basically her mother asked her to go with him to help him in the farm. But she obviously, after the experience of the first 2, I think, she didn't want to go, but she couldn't tell her mom. But her mom pushed her to go, so she went, and then she was abused in the farm. So you can imagine the trauma she went through. So she felt so guilty, ashamed, embarrassed. She genuinely believed it was all her fault. So she kept it to herself all her life. So for the first time, she opened up in the therapy session. So there was no emotional support from her parents because being first generation Indians, they ran a family business and they were so busy. And also they were very strict as well. So although they had good intentions, but there wasn't much emotional support for her. So she didn't open up her story to anybody. Then she got married and she had a son, but she continued to feel ashamed. She didn't really have much happiness in her married life. So basically, she believed she was bad luck to her husband's family because soon after they married, her husband lost his job. And then the sister-in-law was diagnosed with cancer. So she always thought that she was bad luck. And then the husband ran a post office and she jointly worked with him. So they were very busy with their life. Then what happened to their son? So obviously they spent very little time with their son. They were so busy. And her son had a lot of behavioral problems relating to truancy, and also he got into addictions, drug addictions. And he was physically abused by his father for these bad behaviors. And Mala didn't really know how to protect him. So then he dropped out from school and he ran away from home when he was 16. So just last year, her husband was diagnosed with dementia as well. So you can see the number of trauma this whole family went through. So Mala, my client, she was sexually abused. She herself experienced emotional neglect by her parents. Then she lost her son, and her husband was diagnosed with dementia. There's a loss. She can't communicate properly with him now. And her son went through physical abuse, emotional neglect. So both of them actually have gone through trauma. This is what we call trauma. So Gabor Mate, he is a trauma specialist. He says trauma is not what happens to you, rather what happens inside you. So that's psychological wound. So if we look at the causes, broadly speaking, we can actually divide that into two groups. So one is a single, overwhelming, horrific, dangerous, frightening event. Or it could be multiple, repeated, continuous, serious, overwhelming events. So with Mala, we know that she actually had repeated but dangerous, horrific events. Whereas with her son, it's multiple, repeated, overwhelming events. And if we go into the details of trauma, so it can be because of physical and sexual assault, as happened to that family, a prolonged emotional abuse in domestic settings, such as childhood neglect, so growing up lacking adequate care, attention, or support. And if they had experience in combat battle, accidents, natural disasters, forced displacement from their own home and countries, catastrophic losses of one's home. And then if there was a serious injury or illness like cancer, and if they lost somebody they're close to suddenly, that can cause trauma as well. So, and then there are other traumas as well. If you are, it's called vicarious trauma. So if you are with somebody who is traumatized and you witness the trauma, then you yourself may get traumatized. Or it could be a provider, a professional like carers, or professionals like therapists or doctors, or it could be carers. So that's called vicarious trauma. And then I need to mention this special trauma, especially for our community, Sri Lankan community. So historical trauma. So genocide, mass violence, racial oppression, and then other groups like Africans and other minorities, slavery, forced displacement from their homes and own countries. So when people go through that sort of historical trauma, then it affects the whole community, whole family. So they can, the community can retransmit the trauma to their children and to other community people by relating, by telling their narratives again and again, or telling about their stories, and then providing the same conditions, like repeating the patterns of behavior, like autocratic parents. So that's so by providing those things, you can retransmit the trauma. And also, if one is traumatized, then they can't be a spontaneous, fun-loving person. So parents can't provide that sort of spontaneous, fun-loving relationship. That means there can be attachment problems for the child. And then studies have shown that there's a possibility that traumatized gene can be passed on to other generations as well. So these are the causes of intergenerational trauma. So you can actually see that in Mala's son as well, to some extent. So the 3 generations, like, her parents, the first generation parents, moving from India to Kenya, from Kenya to here. So with all this displacement, they would have gone through trauma. And then Mala, and then from Mala to son. So for us to understand what are the effects of trauma and why people behave in a certain way, we need to actually understand how our brain works. So brain is a complex organ. So what I'm going to do now is I'm just going to talk about the 3 parts that are more relevant to trauma and our behavior. So the yellow color one, and the blue and the red, these are the ones you need to focus on. So through evolution, over many years, our brain has developed. So it started with this reptilian reptiles brain, which has got sort of basic function. So when we say basic function, it is about basic regulatory function. It's like if our temperature drops, then body make changes to make it go up. If our blood glucose drops, then it makes our blood glucose to go to the normal level. And if our blood pressure drops, then it does things. So that sort of regulatory stuff is done by this reptile brain. And that it doesn't mean that it hasn't got other parts. It has a little bit of the other parts, but predominantly it has this. And then have so this is the most ancient one. And the next one is the emotional brain. It's called limbic system. I think we need to actually know about these 2 organs, these 2 parts, amygdala and hippocampus. These are very much important for us to understand our behavior. And then the prefrontal cortex. So this is the most sort of latest developed part of our brain. That is the brake. That's what controls everything. That's what inhibits our unwanted actions. So that you will see with primates, apes, and humans. So I have just simplified it by putting these 3 parts this way so that you can understand it better. So this is prefrontal cortex, our thinking brain, and that's like a brake, and then the emotional brain, and then this is the basic one. So I'll just give you some examples for you to understand how this works. So like I'm just going for a walk and accidentally, say my arm or something poked by a thorn. Then what will happen? My basic brain, the brain stem part, will immediately get activated. So then what happens? I'll try. That's what we say, that this flight, fight, freeze response is what we get whenever we get a threat, a danger or threat exposure. So the brainstem will get stimulated. So that means that my body will try to avoid that. So flight. So that response. So what happens is then the vagal, we call sympathetic nervous systems, the sympathetic nervous system get stimulated, and then immediately I'll try to go away, avoid that. So that's the function of the brain stem, the basic one. Like I was actually bitten by a dog when I was a child. So that's actually in my memory, this limbic system memory, hippocampus, carries that with me. So whenever I see a dog, I immediately get scared and my sympathetic nervous system will start to work very quickly, and I will try to run away. So that's, again, the flight thing. But here, my limbic system, the amygdala, the hippocampus has the memory, and then immediately it passes to amygdala, and the amygdala scan it as a threat. It's like a smoke alarm of our brain. So it immediately get triggered, and then it makes the sympathetic nervous system to work, and also it produces lots of cortisol. Cortisol is what gives us more sort of strength, increase the sympathetic nerve, increase our heart rate and pumping, and the cortisol also does all these things to prepare us for the fight or flight. So that will happen. So while this is happening, our blood need to be sort of concentrated on this area, and therefore the prefrontal cortex gets shut down. So we won't have time to think about anything. So it will just automatically happen, right? So it's like a corner. I just saw the dog first, and then I get these reactions, and then I see that there is an owner of the dog behind with a lead. Then immediately I start to calm down, and that comes from the prefrontal cortex. So that will tell me that it's okay, you will be safe, they will control. So that's how normally works, right? So, but the thing is that, oh, and also I would like to mention about freeze response. Say there wasn't anybody, and I am faced with a dog, and then what will I do? I mean, the dog is very near me, so there's no point in me running. So sometimes I may just freeze, or I may try to sit down and stay that way and try to do things. So that's what we call freeze response. And if you go back to my client's case, Mala, when she was abused, she might have elicited the freeze response. She couldn't do anything. So sometimes when someone exposes severe trauma, then they may have freeze response. So that is also done by our vagal system, and that is parasympathetic. But generally, the parasympathetic nervous system is what gives us the green system. That's what, when we are calm, and when you do your yoga, mindfulness, all those things, what you're doing is you're actually stimulating your parasympathetic system, and that's what helps us. And but when our sympathetic nervous system gets stimulated, we are in this yellow area. And that's when all this pumping and heart rate increase and all those things happens. And then freeze response. So someone is like, the tortured people, they will just go into numb. They will freeze and they will get disconnected, because that is another way of their survival survival mode they elicit. So that's what happens. So when the threat and all these things they experience are overwhelming and dangerous, and then what happens is that they actually get stuck in this. So as I told you that, so once I know that I wasn't at risk, my prefrontal cortex start to work, and then everything goes back to normal. But if someone had a severe experience, overwhelming experience, then what happens? They get stuck in this. So when they get stuck in this, what happens? So there's lots of cortisol, as I said, and this adrenaline, and then sympathetic nervous system gets stimulated. So that is continuing. The amygdala will not stop. So it will be in high alert. So it continues this cortisol production and stimulating the adrenaline sympathetic nervous system. So then you have a dysregulated nervous system, dysregulated emotions. So that means that everything will be upset, not in balance. So when you have too much of cortisol, what happens is this hippocampus area, the cells in hippocampus start to die. It can kill the hippocampus. So that shrinks the hippocampus. So once hippocampus is shrunk, what happens? Our memory get affected. We get confused. We don't know which is present, which is past. So we can't differentiate past from present. So that's when you get this flashback. You get intrusive thoughts. You think the trauma is in front of you. Here and now you have the trauma. So you can't really stop thinking about it. So that happens with the hippocampus. So the processing of memory get affected. The short-term memory can be affected. They will have memory loss problem as well. And then if the sympathetic nervous system is hyperstimulated, it's working continually 24/7, then what happens? It gets tired. And then so you get the depression, lethargy, and then the cortisol, excess cortisol can give you low immunity. Then you get chronic illness problems. And the prefrontal cortex, when it is not in use, if you don't use something, then what will happen? It will get smaller, atrophied. So disuse can make the prefrontal cortex to shrink as well. And also cortisol may have some effect as well. So this is what happened with trauma. The thing is that you don't have to go through trauma to have these things. Stress, in our modern world, stress can give the same problem. So when we are under stress, our amygdala is in high alert, then the same thing happens. You produce lots of cortisol, your sympathetic nervous system is always in action, right? So that means that you will be panicking, and so you will be always in an irritable mood. Then your prefrontal cortex won't work properly as well, so that get shut down as well. So these are the things happen if we don't really take care for ourselves. So if we go back to our case, so she had the dysregulated nervous system, emotion problems, and because her the sympathetic nerve was hyperactive, so she suffered with anxiety and hyperarousal. She was irritable as well. And whenever somebody talk, they get irritated, but they think the others are irritable. But actually, it is their hyper arousal of amygdala make them get irritated. And then intrusive thoughts, poor memory she had, and she felt numb at times, and low self-esteem, low mood. And then she had chronic tiredness problem, and she left her job as a pharmacist before. And then she had sleep disorder as well. So, and if you look at her son, he had no secure attachment because of emotional neglect. And therefore, he couldn't trust anybody. So he was disorientated and he was anxious. So his only reliable friends were drugs and alcohol. That's how he became addicted to drugs. So here, as I said before, he had intergenerational trauma. On top of it, he had teenage brain. So I need to mention about teenage brain here. So I said that, so here, if you just look at this, so with teenagers, their prefrontal cortex fully develops only after they pass 25. But the amygdala is fully developed by the age of 16. So that means that they don't really have much control from prefrontal cortex. So, and because their amygdala is fully developed, they, without the control of this, they can actually get they get the impulsive action and they can't control themselves. So this sort of teenage behavior happens because they don't have much prefrontal cortex. So that was there as well with this her son. But luckily he moved to Denmark and he found a supporting partner and he graduated as a mature student. But he was so angry with his parents. he actually cut contact with them. So now coming to self-care means caring for others. So you can actually see in these cases, as I said, with 3 generations, because there was so much trauma and they didn't do anything about it, that passed on to the other people. So that's why it's important that if we have any problems, we need to actually take proper care, right? So, and emotional neglect and problems with attachment during childhood due to poor knowledge of attachment dynamics is very common. They are very common nowadays in this modern society, right? With the modern social system, mother has to go to work and everyone is in a rush. So these things happen. So that's why we have to be careful. We have to be aware of these problems. So when we look at self-care, improving our mental health, we need to be aware that all these 5 things interact. Our behavior and our thoughts, what we think cognitively, and what we feel in our body, and the emotions we feel, and the surrounding we are in, they all interact. So whenever we think about self-care, we really have to focus on those things to see. We need to be aware. How am I wearing? How am I behaving? What is the thoughts going through? What are the thoughts going through in my mind? And what am I feeling? Where do I feel the tension in my body? Am I having some bowel problems? Some pain in my tummy? So focusing on those things are very much important for us to understand, and the emotions and where we are. So the important thing is, when someone has poor self-care, they need to be aware of this and they need to approach proper help. Right? So if they go to a professional psychotherapist or counselor, they make sure that they get these 3 basic things. So Judith Herman actually put forward this. So 1, they need to be in a safe place. So they need to feel that they are in a safe place. And the second thing is, they need to mourn the loss. So they actually have lost their childhood, lost everything. So they need to mourn. How do we do the mourning normally? When we lost somebody, we cry, we talk, and so that's what needs to happen. If you don't do that, and if you keep it to yourself, then you're going to be traumatized. So that's what they do. They actually, so the psychotherapists provide a safe environment and then allow them to talk. So secure environment, reparative relationship. If they didn't have a mother or father, a good enough mother or father, then providing that sort of relationship. And it has to be consistent, caring, and supportive. And lots of validation to tell them that it's okay. It's okay. They will recover. So a lot of validation of their story as well. And then let them tell their story. And then only you can work on connecting to the world. And how we connect to the world. So if we just go back to the brain diagram again. So now this prefrontal cortex, which is not working at the moment, has to be turned on. It has to have rewiring. The fortunate thing is our brain has got neuroplasticity. It can repair. So we need to do the right things to repair them. And the limbic system and the brain stem all need to be connected to this frontal lobe for it to start its new growth, new wiring. So how we do it? We actually introduce these things, like, going through the thoughts, make them to talk about their thoughts, emotions. What is the meaning of trauma? Like my client, she felt that I was at fault. So just going through that and correct and revise their narratives, and there were memory gaps and errors in their beliefs, then correct them and give them hope. life can be rewarding, and we do actually grow as a result of the events. Like Sri Lankans, we all know that because of our war and all those things, we have actually grown out of that trauma and developed resilience. So we do that. And obviously, I don't need to talk about mindfulness to this forum. You all know thoroughly about it. But mindfulness and biofeedback are treatment for this. So what we do there is like, now with your deep breathing, what you're doing is by stimulating the vagal system, which is in the diaphragm. Diaphragm is the partition, the muscular partition between our chest and abdomen. So that's where the vagal system is. So by stimulating mindfulness, by stimulating that, you are actually stimulating the parasympathetic nerve that gives you the calmness. And so by doing that, then you are actually connecting to prefrontal cortex as well. And then consciously thinking about all these things, all these things I mentioned before with the brain functions, they are unconscious things. We don't really know that's going on. Whereas here, we try to do conscious things, like consciously thinking about the breathing, consciously thinking about the emotions. And then you slowly start to connect to your brain, to your prefrontal cortex. So, and then the sympathetic nervous system start to regulate as well. So it's just all about the present moment awareness. And then slowly the hippocampus start to grow as well. And then it will start to remember things. So the other activities you all know, and recently Tara actually sent a list as well, so I don't need to go through that. So coping strategies, self-soothing activities, self-compassion, and journaling. Journaling is very good. I mean, obviously, if you don't want to go to a therapist, if you don't want to go to a therapist, you can, at least if you can write, if you do journaling, then you express your emotions. You're connecting all these to your brain, to your prefrontal cortex, your thinking brain. So that may help as well. And gratitude is the big thing. So by expressing gratitudes, you're making other person happy. And when you see the other person being happy, that is an emotion that actually feeds your prefrontal cortex. So it turns on your prefrontal cortex. Feeling of contentment does the same thing. And exercise, that is another important thing. Exercise can make the hippocampus cells to grow, to recover, right? And for probably with the prefrontal cortex as well. So, and then other professional treatments available for people who have severe trauma, so they need to be aware of that as well. An update on Mala. So, I did actually 15 sessions and she's much happier and she managed to connect to her son. And so now she has improved her communication with the husband and she spent a lot of time with him. And she found his dementia is actually slowly getting better as well. And she has started to get herself connected to lots of social activities. So I just want to finish my talk with this saying from Tirumular again. So he says that Udambar aliyil uirar alivar, Tirambada meinyanam seravam maatar. Udambai balarkam ubaya marinde, Udambai balathen uir balathene. So basically here he is saying, if I want to attain salvation or realize the Supreme Being, then I have to actually look after myself, because if I don't have the body, then I can't do it. So I suppose we can say that service to humanity is service to God. So if we want to care for others, then we have to look after us. So that's my summary. So we need to be aware of these things all the time. And then healthy relationship, reduce loneliness, reach out for help, and if appropriate, professional help, and then meditation, mindfulness, regular exercise, journaling. Thank you so much for giving me this opportunity.
That was an incredible and informative session, Dr. Sasikala, Master.
Thank
For
you.
the appreciation, we will clap our hands for 30 seconds.
Thank you.
Thank you.
Okay. And now we will go on to the feedback session, which will be done in English. We'll start with a couple of questions from Khan Kuganesan Master, please. Unmute, please. Yeah.
Thank you very much indeed. இமைப்பொழுது மின்னெஞ்சில் நீங்காதான் தாழ்வாழ்க. Amma, your speech is wonderful and very well explained. I mean, I will say something on your speech and then I will ask a question. Okay, if you can, please answer it. If I can say to you, there is a writer. Her name is Elena Brown. She is actually saying, when you take time to replenish your spirit, it allows you to serve others from the overflow. I think I really, and she go on saying, you cannot serve from an empty vessels. Okay, that's the thing he's saying. So by looking at it, I mean, if I can put it in Tamil, there is a Thevaram, Ennil Yarum Inakiniyaridar, Ennilum Nallan Uruvanulan. It's starting with that. I don't want to go into the detail because we need to say to ourselves, I am the best person for myself. If I can do that, possibly I need to be able to help others. I mean, if I am empty, how can I help others? That's the
Absolutely, yes.
That's the first point. The other thing I want to say is there's another saying, almost same anyway, love yourself first and everything else falls in line. You really have to love yourself to get anything done in this world. That's all I want to say. But having said that, if I can ask the question, I mean, on your trauma matter you mentioned, I mean, the question is this. Do you think that one man's trauma effect can be passed on to the future generation through his DNA?
So as I said that there was one actually research which showed that. I don't really have the details, but certainly it's been quoted. So there is some evidence, but it's not that. It is always difficult to differentiate because there will be always environmental effect and then all these combined. So you can't really separate them, but there is definitely evidence of that.
Okay. Thank you very
and
much.
Also, I would like to mention about this, love yourself. The problem is that this is what younger generation do, isn't it? So we have to define it properly. What sort of love you can have for yourself, right? It's important for us to think about others and think about serving for humanity. So, but the important thing is, as you said, that you have to fill in your glass first before you think about others.
Okay. Thank you very much. Thank you very much. Thanks.
Thank you very much, Khan Kuganesan Master. Next, we have Dr. Jagannathan Master, please.
Thank you.
Thank you. Greetings to everyone. Excellent presentation. Thank you very much, Dr. Rajamanoharan. I also found it very interesting. We brought out real life stories rather than repeating from the book. But I have some issues really. But what you explain in terms of freeze reaction response is accurate actually. Yeah, your presentation was very technical, I thought. I don't know how many people grasped it in full. See, this is an acute phenomena. So one good example is some animals pretend to be dead. So
reptiles do that. Lizard does it. Yeah.
So we also freeze. I wasn't bitten by a dog, but I got scared during the childhood, chased by barking dogs. So I'm also very skeptical about dogs, and I freeze as well sometimes. The problem here is when you have, this is an acute phenomenon. When you have long-term over a period of time, what happens is the technical term there is called dissociation from reality. So I did explain, I don't know, people sometimes find my communication or whatever is not as good. So the dissociation is when the mind dissociates from reality. So either you block. Another good example of acute phenomenon is after acute trauma, children don't speak sometimes. They lost of speech. Not that, and then after a long psychotherapy or resolution, they do recover. So over a period of time, what happens is then you dissociate with reality and then you can block out the event, or they present with physical symptoms. And that is actually the word psychosomatic is no longer is old term. So it's called somatoform disorder rather than psychosomatic. So either they present with physical symptoms or sometimes they present with depressive stupor, they call it. Stupor means they're unconscious, not unconscious, they're semi-conscious, but it's due to depression and they don't feel pain. So these are especially with childhood sexual trauma. During my training, I had a young consultant. He was dismissive of all the schizophrenia diagnosis, and he was trying to work out, and he was accurate. He was correct in a lot of cases. Not, I wouldn't say everyone, but he used to explain that this is not, everybody jump and diagnose schizophrenia. But if you
that's very much true. I have the same view as well.
Yeah. So that's one. And lastly, this I'm telling because not to find fault, but this is what happens. Conscious thinking is said very easily, but people don't know what subconscious mind is and what subconscious activities are. I try to highlight it. So unless we come to know, we don't know the mind games and we don't know how the defense mechanisms affect our behavior.
That's why it's important to be aware of our body feelings. So that's why you have
but what I'm saying is, that's why I keep saying mind matters. Yesterday I I saw a clip from Osho. I couldn't laugh. He was laughing. People were saying, "Oh, I'm a good soul. I'm a good soul," and Osho was criticizing that because if you know good soul, why are you repeating it? And I will actually share it with Sasikala Rajamanoharan. I don't want to put it in for everyone. Last night I saw accidentally, and I thought he's correct because I'm a good soul. If you say I love myself and I say I'm a good soul, what do you mean? What do you gain out of it? Instead of that, you should try and understand. I always say your conscience, love your conscience rather than loving yourself. If you love your conscience or you respect your conscience rather than loving it, you will care for others. One important thing.
That's very true. That's a good point.
Because what happens is when parents are, in the example you gave, they're very strict. When they are very strict, they will provide physical care. They will feed, but they will overlook the emotional development and emotional need, particularly if you had a setback.
That's very common in our generation, isn't it? That is the problem.
Sometimes you have conflicting parenting. One parent is very protective, other parent very strict. So the child is at a loss. These children even end up with sometimes, schizophrenia. And also, you must treat children like friends, particularly after teenage, which I think our Asians are failing. So when you are very strict, either they get rebellious or they go into a cocoon or a bubble. And that's what happens. So these are the things I think the parents should be aware of. Anyway, thank you very much.
That's very much true. I think we may have to do another talk on that bit. But I just want to mention about this freeze response. I think you need to read Porges' book. Polyvagal theory. So there he gives information about freeze response.
Well, a lot of psychologists come out with so many theories.
No, but whatever it is, let me finish. Let me finish.
I read them, but eventually I think about it and take what I make a sense.
But what I'm going to say is my experience. I mean, I'm sure you would have experienced that as well. Like, you're talking about this dissociation of whatever you said, but we see clients actually have disconnected.
But that is the dissociation. Disconnection is dissociation.
Like, they smile, but they are full of sadness. So whenever they talk about something sad, they smile.
As long as the meaning, that's why I say the word doesn't matter. The meaning is that Tamil solradhu sollilla porul da mukkiyam. So disconnection and dissociation are same in a way. When you're associated, it's connected. So when you're dissociated, it's disconnection. So there you are.
So what I'm trying to say is that I think lot of things are known about this freeze response, and only recently people start to understand that freeze response is also done by parasympathetic nerves. So we need to talk about that at a sort of
That's why I said that's an acute phenomena. But otherwise, they go into a cocoon. Thank you very much.
Thank you. Thank you very much. Thank you. Very useful. Thank you for your comments.
Thank you, Dr. Jagannathan Master. Arundhati Master, what would you like to say, please?
Yeah, greetings to all. Thank you very much, Dr. Sasikala Master. You have explained it. Excellent presentation, very informative, and it is very useful for our session because it what from the childhood, the child. This the story that you brought it in today, case study. Mala's parent didn't listen to her because she was telling that she didn't want to go with that person, but they should have listened to her and say, what is the reason, why you are not saying that you are not going to with them? But they didn't listen. But they forced her to go. So she didn't have any choice. She went and she's been abused. Then that is being taken over all her life. And that passed it to her son as well. So son also, so the parents should take care of their child and from how the child been brought up. So it's we have to be very concerned. So it's very good because I know there are so many people raised hand, but it's a very good, excellent performance you have given us. We would like to hear more about it. Thank you so much. Thank you, Dr. Sasikala. Thank you. Thank you.
Thank you, Arundhati Master. Kumaraswamy Pillai Master, please tell your views, and then we can hear your translation in Tamil afterwards, and we can have 10 minutes for the Tamil session. Thank you.
First of all, greetings to everybody. Firstly, I would like to congratulate you for this excellent presentation. Really, we have created an awareness and especially focusing on the trauma because that's the common thing nowadays. So you started with Tirumoolar and ended up with Tirumoolar. That's a great thing. So that means all these things our Tirumoolar said thousands of years ago with the psychology now coming big itself. So we had to respect our saints. They predicted all those things so many thousands of years. Now the psychologists are unearthing and find this. That's a good thing. And you had in detail given us with two cases what the trauma is actually. So nowadays you find with all these things are happening even during our war in Sri Lanka. This had happened, all those things. So first thing in the summary, the message here is firstly, we had to take care of ourselves first. Normally, we know when we go in the mother and child, when they travel on a plane, first they ask us, you say, you first the mask first and then your child. That's the greatest psychology I have learned because if we are healthy only, we can take care of our elders or anybody.
Absolutely.
So that's an excellent message which all of us had to. So first, it should start from our home and then to the society. That's another clear thing. Then another thing you said, see, when we help others, the universe will help us. There's a universal law which is already there. So they always say, what you do, the service to the poor, your service to the society and to the God. So when you want to help others, then another important this always you must empathize with others. That's the most thing you're lacking in this society because we're always selfish, take care of things, and sometimes we sympathize, but sympathy is not enough. We must empathize with others, and then a most important thing is we must live with gratitude. So whatever we have, we must be happy and try to help with what we have to others. So there's a saying that when we give to somebody, we get in manifold return back to them. That's a universal law. So I can go on describing really every one of them is very useful, but especially in the modern context. And I thank you for your wonderful presentation.
Thank you. Thank you. Lingadharan and Nirmala.
நீங்க translation செய்யறீங்க அப்ப எங்களுக்கு டைமிங் இல்லாம போகுது.
No, you can do it after the feedback. I will summarize it.
Okay then.
Greetings to everyone.
எத்தனை மணிக்கு முடிக்க யோசிக்கிறீங்க? இப்ப 9:20 10 நிமிஷம் இருக்கு. ஓகே, carry on. லிங்கம் நீங்க சொல்லுங்க.
Thank you very much. Thank you for greetings to everyone. Thank you for this opportunity. First of all, let me express our sincere thanks and gratitude to Dr. Sasikala for the excellent presentation. So trauma, and I too had the experience when I was studying, when I was advanced level. I did an experiment, when we did the experiment on in the chemical. The chemical went into my eyes and my retina was affected. So I was, for some time I was suffering from so I could not share with anyone because they don't understand. I lost my eyesight of a certain extent. So I know that that affected me. Still then, after some time, I had the opportunity to be the member of Rotary Club. So we had the opportunity to help people, serve the people, so that it came out after that. So now, but I noticed that some people, as you said, trauma, then they go into the mood of depression. So once they go to the depression mood, they go for the doctors prescribe medicine for that instead of giving advice. This is a better way of coming out instead of taking medicine, and I don't know how the medicines are going to help for long term.
Yeah, I mean, for certain clients, I find that when during the acute stage, giving medicine may help. But I personally believe that first we need to do as much as possible from the psychology point of view with a psychologist or therapist. And then they can decide whether that person may benefit from. Because, I mean, I can remember there was one client, she was so depressed. And she came to me, and then I could see the change in her. But the GP, meanwhile, started her an antidepressant. But then I found that it sort of hastened. It helped her to come out of it quickly, and then she weaned off. So, but generally, I don't think majority of the people may not need antidepressant. Yeah.
Thank you so much. Thank you very much.
Thank you. Thank you.
Thank you, Lingam Master. Now it's 9:30. I'll hand over to Kumaraswamy Filling Master.
It's okay, Tara. I'll give it to
sorry.
Master. Yeah.
Anandi
It's okay,
Baladasan Master, which is no, you can say something. It's all right. Don't worry. You can say something.
Yeah, it's an excellent presentation, Dr. Sasikala Master. We learned a lot from your presentation. Let Kumaraswamy Master will give the summary. Yeah, in Tamil. Thank you.
How many minutes I had? How long you can do it? 5? Any time limit, or I want to summarize? I can summarize it this time.
10 minutes, okay. Master, 10 minutes, fine.
Okay.
After that, we can do some feedback in Tamil as well.
அனைவருக்கும் வணக்கம். இன்றைய தலைப்பு சுய கவனிப்பு என்பது மற்றவர்களுக்கான கவனித்தல். திருமூலர் ஆரம்பத்திலேயே திருமூலருடைய உரையுடன் ஆரம்பிக்கப்பட்டது. திருமூலர் என்ன சொன்னார்? நமக்குள்ளே ஒரு தெய்வம் இருக்கின்றார் என்று. அதை வைத்துக்கொண்டு அதை அடிப்படையாகவே இந்த பேச்சு ஆரம்பித்தது. முதலாவது 2 பேருடைய வாழ்க்கை சரித்திரத்தை எடுத்தால், ஒன்று மாலா கென்யாவில் இருந்தவர். அவர் அவருக்கு இந்த வாழ்க்கையிலே ஒரு பேரதிர்ச்சியான சம்பந்தம் நடந்தது. இப்போ ட்ரோமா என்பது உண்மையாக ஒரு நிகழ்வு நகர்ந்து அதன் விளைவாக பேரதிர்ச்சி ஏற்பட்டு உடல்நலம் மனநலம் பாதிக்கப்படுவதைத்தான் வழக்கமையாக நாங்கள் ட்ரோமா என்று சொல்லுவோம். இந்த மாலாவுக்கு நடந்தது என்னென்றால், 3 பேரால் துஷ்பிரயோகம் செய்யப்பட்டார். அதன் விளைவாக அவருடைய வாழ்க்கையிலே பல விதமான உளவியல் கோளாறுகள் ஏற்பட்டது. தன்னை பற்றி குறைந்த சுயமான சிந்தனை ஏற்பட்டது. வாழ்க்கையிலே பதட்டம், நித்திரை கோளாறு, இப்படி பலவிதமான பாதிப்பு ஏற்பட்டது. அதன் தொடர்ச்சியாக அவருடைய மனநிலை வாழ்க்கையிலேயே ஒரு விரக்தி ஏற்பட்டது. ஆனால் இந்த நிகழ்வுகளை அவர் மற்றவரிடம் சொல்லவில்லை. அதுதான் முக்கிய காரணம். அவர் தனக்குள்ளேயே வைத்துக் கொண்டிருந்ததனால் அவருடைய வாழ்க்கையிலே பல இன்னல்கள் ஏற்பட்டது. திருமணம் நன்றாக வாய்க்கவில்லை, மகனும் நன்றாக இல்லை, மகனுக்கும் தாய்க்கும் நல்ல உறவு இல்லை. இப்படியான பல சிக்கல்கள் உண்டவரை நான் பார்ப்பதற்கு எனக்கு வாய்ப்பு கிடைத்தது. அது பின்பு அவர் சொல்லுகின்றார், சிகிச்சை மூலம் அவர்கள் நன்றாக மகிழ்ச்சியாக இருந்தார் என்று கூறி முடிக்கின்றார். அது அடுத்ததாக நாங்கள் அது எப்பொழுதும் பல வகையான உளவியல் பாதிப்புகளுக்கு உள்ளாகின்றோம். அதுக்கு பல காரணங்கள் இருக்கின்றன. ஒன்று சில காரணங்கள் இருக்கும், அல்ல பல அவற்றையெல்லாம் நாங்கள் பார்க்க வேண்டும். இந்த முக்கியமாக உளவியல் ரீதியான கோட்பாடுகள் குறைபாடு இருக்கின்றன. அவர்கள் உடல் மூளையை பற்றி மிக விவரமாக கூறியிருந்தார்கள். அதாவது எங்களுக்கு எல்லோருக்கும் தெரியும், உதாரணமாக ஒரு முள்ளு குத்தினால் எப்படியான உணர்வுகள் எங்களுக்கு ஏற்படும் என்பதற்காக எப்படி மூளை அமைந்திருக்கிறது என்பதை பற்றி மிக தெளிவாகவும் விளக்கமாகவும் கூறினார். சுருக்கமாக அவர் சொல்றாங்க, மூளையில 3 இருக்கின்ற. ஒன்று ப்ரீ ஃப்ரண்டல் என்று சொல்வார்கள், அதன் பண்பு அது சிந்தனை. லிம்பிக் சிஸ்டம் என்பது உணர்ச்சி பூர்வமானவற்றை உண்டாக்குகின்றது. அடுத்தது பிரெயின் சென்டர். அடுத்தது 3வது முக்கியமானது என்றால், இது ஒரு நிகழ்வு நடக்கிற பொழுது 3 விதமான உணர்வுகளை ஏற்படுத்தும். ஒன்று ஓடுவதா, அல்லது நின்று சண்டை போடுவதா, அல்லது செயலற்ற நிலையில் இருப்பதா என்ற 3 விதமான உணர்வுகளை இது எந்த விதமான உதாரணமாக நாயை பற்றி சொன்னார். நாய் வரும் பொழுது அந்த நாயை பார்த்த உடனே எங்களுடைய மனத்தில் இப்படியான உணர்வுகள் எல்லாம் வந்து கொண்டிருக்கும். முதலாவது சிந்தனையில் ஒரு கோளாறு ஏற்படும், அதற்கு பின்பு தெளிவு ஏற்படும், அதற்கு பின்பு நாய்க்கு பின்னால் சொந்தக்காரன் வருகின்றான் என்ற பொழுது சிந்தனையில் மாற்றம் ஏற்படும். ஆகையினாலே ஒரு நிகழ்வு நடக்கின்ற பொழுது எங்களுடைய சிந்தனை பலவிதமான சோதனைகளுக்கு ஆளாக்கின்றது என்பதை அவர் மூளை எப்படி செயற்படுகின்றது என்ற விரிவாக எங்களோருக்கும் புரிந்திருக்கும். நான் அதை பற்றி முன் சொல்லவில்லை. ஆனால் வழக்கமாக நாங்கள் கேள்விப்பட்டிருக்கிறோம், எப்பொழுதும் வாழ்க்கையிலே எங்களுக்கு 3 விதமான தேர்வுகள் இருக்கின்றது. ஒரு நிகழ்வு இருக்கும் பொழுது அது ஓடுவதா, அல்லது நின்று போராடுவதா, அல்லது செயலின் நற்ற இல்லை இருப்பதா என்ற கேள்விக்கு அந்த விடையை எங்கள் மூளையே சொல்லிக் கொடுக்கும் என்பதை விவரமாக இந்த முழு குத்துற கதையும் நாயின் கதையும் வடிவாக சொன்னார். உண்மையிலேயே நான் பாராட்டுகிறது. அடுத்தது இப்படி நாங்கள் எங்களுடைய மூளையில சில அமிலங்கள் சுரக்கின்றன. அவைகள் தான் எங்களை மகிழ்ச்சியாக வைத்திருக்கின்றது. மற்றது இப்படியான இதுகளில் என்ன நடக்குன்றாங்க, இப்படியான மன அதிர்ச்சி ஏற்படும் பொழுதுதான் எங்களுடைய வாழ்க்கையிலே பலவிதமான பாதிப்புகள் ஏற்படுகின்றன, தாக்கங்கள் ஏற்படுகின்றன, பதட்டம் ஏற்படுவது, மற்றவர்கள் பேரன் வெறுப்பு ஏற்படுறது, விரக்தி ஏற்படுறது, தங்களை பற்றி தாழ்வு மனப்பான்மை ஏற்படுவது, எல்லாத்துக்கும் காரணம் இதுதான். இந்த நிகழ்ச்சிகள் தான் இந்த தாயுடைய வாழ்க்கையை பழுதாக்குகின்றது. மகனும் இதன் காரணமாகவே தவறான வழியில் சேர்ந்து மதுவுக்கு அடிமையாக்கி தன்னுடைய வாழ்க்கையை படித்துக் கொண்டார்கள். அடுத்தது இப்ப இதிலிருந்து நாங்கள் என்ன செய்கிறோம் என்றால், நாங்கள் முதலாவது எங்களை கவனிக்க வேண்டும், நாங்கள் எங்களுடைய வாழ்க்கையை மேம்படுத்த வேண்டும். அது அப்படி இருந்தால் தான் நான் மற்றவர்களுக்கு முடியும். இங்கே பார்த்தோம்னால் மாலாவின் வாழ்வை பாதிக்கப்பட்டது, அந்த பாதிப்பு பிள்ளைகளையும் பாதித்து கணவனையும் பாதித்திருக்கின்றது என்பது தெளிவாக இருக்கின்றது. ஆகையினாலே முதலாவது சுய கவனத்தில் இன்றியமையாதது. அதற்கு பின்பு நாம் மற்றவர்களுக்காகவும் சமூகத்திற்காகவும் கவனிக்க வேண்டும். அப்போ இதெல்லாம் சிறு வயதிலே ஏற்படுகின்ற அனுபவங்கள் தான் எங்கள் வாழ்க்கையிலேயே பெரும் பாதிப்பையும் எப்படி எங்கள் வாழ்க்கை அமைய போகிறது என்பதை தீர்மானிக்க என்பது எந்தவித மாற்று கருத்தும் இல்லை. ஆகையினாலே சுருக்கமாக என்ன மாதிரி ஒரு சமூகத்தில் நாங்கள் செய்யும் பொழுது முதலாவது ஆரம்பம் எங்களுடைய சிந்தனை. அதுக்கு அந்த சிந்தனையின் மூலமாகத்தான் உணர்வுகள் தூண்டப்படுகின்றன. அந்த உணர்வுகள் தூண்டப்படுவதோடு தான் எங்களுடைய செயல்பாடுகள் இருக்கின்றன. இப்போ நாங்கள் ஒருவருக்கு உதவி செய்ய வேண்டும் என்றால் எதில் கவனம் செலுத்த வேண்டும் என்றால் இந்த 4 விஷயங்களையும் கவனத்தை முதலாவது எங்களுடைய சிந்தனை எப்படி இருக்கின்றது, அந்த குறிப்பாக நோயாளியோ பாதிக்கப்பட்ட சிந்தனை எப்படி இருக்கின்றது பார்க்க வேண்டும். அதனால் ஏற்படுகின்ற உணர்வுகள் எப்படி இருக்கின்ற வேண்டும், மற்ற எப்படிப்பட்ட பாதிப்பை காட்டுகின்றார், மற்றது சுற்றுச்சூழல் எப்படி இருக்கிறது என்பதை பார்க்க வேண்டும். இப்படி இருந்தால் தான் நாங்கள் சாதிக்கும். அப்போ அடுத்தது முதலாவது பாதுகாப்பான இடத்துல இருக்கிறார்களோ என்று பார்க்க வேண்டும். அடுத்தது இப்ப நாங்கள் சில செய்வங்கள பார்த்தா ஒரு குடும்பத்திலே கணவன் எல்லாம் வந்து விட்டால் மனைவிக்கு சுண்டம் அப்ப நாங்கள் முதலாவது அவரை அளவிட வேண்டும், அவருடைய கருத்துக்களை வெளியிட வர வேண்டும், என்னென்ன உள்ளத்தில் இருக்கின்றோ அதை சொல்ல வேண்டும். இப்போ தனக்குள்ளே அடக்கி வைக்காமல் மற்றவருடன் பகிர்ந்து கொள்ள வேண்டும், உணர்வுகளை வெளிப்படுத்த வேண்டும் என்பதை மிக கூறினார். மற்றது சமூகத்துடன் நெருங்கிய தொடர்பு ஏற்படுத்த வேண்டும் என்பதையும் தெளிவாக சொன்னார். ஆகையினாலே நாங்கள் ஒரு பேரரசியால் பாதிக்கப்பட்டிருக்கும் பொழுது இவற்றை கவனிக்க வேண்டும் எனக்கு ஒளிவாக சொன்னார். அடுத்து எப்பொழுது மூளையை நாங்கள் மாற்ற முடியும் என்று சொன்னார். என்ற வாழ்க்கையில சில இடங்கள் நியூரோபிளாஸ்டிசிட்டி என்பதை பற்றியும் தெளிவாக சொல்லியிருந்தார். இப்போ மிக அடுத்ததாக நாங்கள் இந்த தளத்திலே மீண்டும் சொல்வது மனந்தெளி நிலை, அதாவது மைண்ட்ஃபுல்னஸை நாங்கள் பின்பற்ற வேண்டும் என்பது மிக மிக முக்கியமான ஒரு கருத்தாக இருக்க வேண்டும். நாங்கள் இப்படி நாங்கள் இப்பொழுது தியானத்திலே மூச்சை கவனிக்க வேண்டும். அதுக்கு அறிவியல் சார்ந்த உளவியல் சார்ந்த விளக்கத்தை எங்களுக்கு கொடுத்திருக்கின்றார். ஆக நாங்கள் கண்மூடித்தனமாமல் மூச்சு எடுக்காமல் அதை செய்வதால் என்ன பலன் என்பதை நான் அறிந்து கொண்டிருக்கேன். அதை பற்றி நான் கூட விருப்பமில்லை நேரம் கேள்வி உண்மையிலே நன்று. எப்பொழுதும் நிகழ்காலத்திலே நடப்பதிலேயே எங்கள் முழு கவனம் இருக்க வேண்டும் என்பதையும் மிக வலியுறுத்தி கூறியிருக்கின்றார்கள். அடுத்தது எப்படி நாங்கள் இதுக்கு இயற்கையெல்லாம் எப்படி நாங்கள் தவிக்கலாம் என்றது பல உத்திகள் இருக்கின்றன. அதுல ஒன்று நாங்கள் கவலைப்படும் பொழுது எழுதும் பொழுது அது ஒரு தெளிவு ஏற்படும், எழுத்துல வேண்டும். மற்றது எப்பொழுதும் நாங்கள் முதலாவது சுய பச்சாத்தாபம் இருக்க வேண்டும். அதன் பின் மற்றவர்களை பற்றி பரிதாபம் கொள்ள வேண்டும். மற்றது நன்றி உணர்வுடன் வாழ வேண்டும். நன்றி உணர்வு இருக்கும் பொழுது ரெண்டாவது இல்லை, ஒன்று பிற செய்ததற்கு நன்றி, அடுத்தது பிரபஞ்சம் கொடுத்தது இது போதும் என்று திருப்தி, போதுமன்ற மனைவியை பொன் செய்யும் மருந்து என்ற கோட்பாட்டுடன் வாழ வேண்டும். அது மிக முக்கியமானது என்று சொல்லும். மற்றது உடற்பயிற்சி செய்ய வேண்டும். மற்றது இப்ப இன்றைய காலத்தில் இந்த காக்னிட்டிவ் தெரபி என்றது இப்ப அறிவு ஆற்றல் இழப்பை நாங்கள் சிகிச்சை கொடுக்கலாம் என்பதை அவர் சொன்னார். அதுக்கு ஒரு உதாரணமாகத்தான் மாலா என்ற ஒரு கேஸ் முடித்தார். எப்படி திருமூலருடன் ஆரம்பித்தாரோ திருமூலருடைய நிறைவு செய்து ஒரு அற்புதமான வழியை வழங்கினார். இந்த வாய்ப்புக்கு நன்றி கூறி விட நன்றி.
AI translation. AI translation கூட இந்த அளவு நல்லா இருக்காது.
Thank you. That was an excellent translation. We'll clap the hands 30 times. Thank you very much, Kumarasamy Pillai Master. And now I will hand the platform over to Sasikala Rajamanoharan Master. Thank you.
எல்லோருக்கும் வணக்கம். முதல்ல குமாரசுவாமி பிள்ளை ஐயா அழகான மொழிபெயர்ப்பு, பல விடயங்களை விளங்கிக் கொள்ளக்கூடியதாக அந்த மொழிபெயர்ப்பினை தந்திருந்தீர்கள். அதாவது கலாநிதி சசிகலா ராஜமனோகரன் அம்மா எவ்வளவு விடயங்களை தந்திருந்தீர்கள், பெற்றுக்கொள்ளக்கூடியதாக இருந்தது. நான் ஜெர்மனியிலே நீண்ட காலம் இருக்கிற காரணத்தினாலே ஆங்கிலம் அதிகம் மறந்து போய்விட்டேன். ஆகையினாலே புரிந்து கொள்வது கொஞ்சம் கடினமாக இருந்தது. குமாரசுவாமி பிள்ளை ஐயா பேசி அதன் மூலம் தாராளமாக பெற்றுக்கொள்ளக்கூடியதாக இருந்தது. மிகவும் நன்றி அம்மா, நன்றி.
வணக்கம். மிக அழகான ஒரு சிறப்பான பேச்சு இன்றைக்கு இடம்பெற்றது. மிக்க மகிழ்ச்சி, நன்றி. நான் ஒரு கேள்வி கேட்கின்றேன். நீங்க சொல்லும் போது அமக்காலா, ஹிப்போகம்பஸ், சிம்பாத்தெட்டிக் நர்வ், பாராசிம்பாத்தெட்டிக் எல்லாம் நீங்கள் அழகாக கொண்டு வந்தீர்கள். எல்லாம் என்னுடைய கேள்வி என்னதான் வந்தாலும் எங்களுக்கு ட்ரோமா வருது, டிப்ரெஷன் வருது, ஸ்ட்ரெஸ் வருது, என்னதான் வந்தாலும் நாங்கள் இந்த பாராசிம்பத்தெட்டிக் நேவையும் வேகஸ் நேவையும் நாங்கள் ஸ்டிமுலேட் பண்ண பழகினால் எப்பவும் ஹாப்பியா நாங்கள் இருக்கலாம். இந்த ட்ரோமா இல்லாம போகிடும். the vagus nerve ஒரு kind of parasympathetic nerve போல தான் ஆக்ட் பண்ணுது. பட் அது
வேகஸ் நர்வ் வந்து parasympathetic போல தான் ஆக்ட் பண்ணுது. எஸ்,
அதுவும் இது வேகஸ் நர்வ் வந்து மூளை நரம்பு, parasympathetic இல்ல, அந்த 12 நரம்புல வராது. ஆனால் இந்த வேகஸ் நரம்பையும் இந்த parasympathetic நர்வையும் நாங்கள் ஆக்டிவேட் பழகினால், ஸ்டிமுலேட் பண்ண பழகினால் எங்களுக்கு எப்பவும் ஹாப்பி. இதை அக்ரி பண்றீங்களா?
ஆமாம், நிச்சயமா. ஹாப்பின்றது வந்து நாங்கள் என்ன ஃபீல் பண்றோம்ன்றதெல்லாம் ஹாப்பினஸ் இருக்குது. பட் நிச்சயமாக நீங்க அதை செய்யும் பொழுது நீங்க காமாக வருவீங்க. காமாக வந்தால்
ஒரு எக்ஸாம்பிள், இப்ப ஏதோ சம்திங் நடந்துடுது அண்டா ஹாப்பி இல்லாம இருக்குதுண்டா சொல்லலாம், மெடிடேஷன் செய்யுங்க, ஏதாவது செய்யுங்கன்னா ஓம் என்று சொல்லும் போது இந்த வெளி இது, அதாவது சுவாசம் கூடுதலாக வருகிறது. வெளி சுவாசம் கூடுதலான நேரத்தை எடுக்க முறை வர அகாரம் உகாரம் மகரம், வெளி சுவாசம் பெருசா வாரதால எங்களுக்கு ஹார்ம். நான் அது செய்யறேன்னா என்னதான் வந்தாலும் எதிர்மறை எல்லாம் போயிடும், கவலை போயிடும், அழுக போயிடும். அப்ப கோயில்ல போயிருந்து நாங்கள் ஓம் என்று சொல்லல, சந்தோஷமா நாங்கள் திரும்பி வர்றதுக்கு இந்த வேகஸ் நர்வ் தான் இந்த ஓம் என்ற இதால டோன் பண்ணப்படுகிறது. அதையும் இந்த தளத்துல இந்த வேகஸ் நர்வுக்கும் பராசிந்ததுக்கும் பெரிய கன்ஃபியூஷன் ஒன்று இருக்கிறது. இதை இன்று உங்கள் முன்னால தெளிவுபடுத்த விரும்புகிறேன். இப்ப வேகஸ் நர்வ் வந்து முழு பராசிம்பத்தேட்டிக் நர்வையும் கண்ட்ரோல்ல வச்சிருக்குது. ஒட்டுமொத்தமாக வேகஸ் நர்வும் பராசிம்பத்தேட்டிக் கிட்டத்தட்ட முழுக்க ஒரே மாதிரி வேலையை செய்யுது. ஒரு டோன் பண்ணும் போது உடம்பு முழுதும் எங்களோட பாடி ஃபீலிங்ஸ் எல்லாம் மாறுது, சந்தோஷமாக நாங்கள் இருப்போம். நான் சிம்பிளா இத நான் சொல்றேன்.
நீங்க சொல்றது சரி. அது ஆமா,
இத கூட கதைக்கா சில நேரம் கன்ஃபியூஸ் ஆகிடும். ஒரு வசனம் இவ ஹம் பண்ணி கொண்டிருப்பினோம். சில பேர் அவைக்கு ஒரு வசனமும் பேக்லால வேற அதான ஹம் பண்ணினா சாண்டிங் இருக்கிறது. ஒரு வசனத்தை சேம் திங். அப்ப அவைய பார்த்தால் நல்ல சந்தோஷமா தான் இருப்பினோம். அது நான் அதுல அது என்ன சொல்லணும்னா, அது பராசிம்பத்தேட்டிக்கும் வேகஸ் நர்வும் நல்ல ஆக்டிவா இருக்குது, நல்ல ஹையா இருக்குது. அவ எப்பவும் சிரிச்ச முகத்தோடயே இருப்பினோம்.
நீங்க அதை ஸ்டிமுலேட் பண்ணோடனே நீங்க ரிலாக்ஸ்ட் ஆகுறீங்க, காம் ஆகுறீங்க. காம் ஆகணும்னு உங்களோட மசில்ஸ், முகத்துல உள்ள மசில்ஸும் எல்லாம் ரிலாக்ஸ்ட் ஆகுது. அப்ப எல்லாம் ரிலாக்ஸ்ட் ஆக விட்டோன்னே அந்த உங்களோட பாடி இதை வந்து உங்களோட ப்ரீஃப்ரண்டல் கோர்டெக்ஸ் அறியுது. அது நீங்க ஃபீட் பண்றீங்க அந்த மெசேஜ் அதுக்கு. அப்ப இட் கிவ்ஸ் யூ ஹாப்பினஸ். அப்ப அப்படித்தான் எல்லாம் ஒன்றோடு கனெக்டட். அப்ப அதான் the reason.
ஃபைனலி ஒன்று நல்ல ஹாப்பி வேற. உங்களுக்கு ஹாப்பி இல்லாம இருக்கே உங்களுக்கு நித்திரவாறு இல்ல. ஆனால் இப்படி நாங்க ஸ்டிமுலேட் பண்ணும் போது ஹாப்பி வருதுண்டா. இப்ப ஓமன் இது என் எக்ஸ்பீரியன்ஸ். நான் ஏதாவது நான் ஓமன் சொல்ற பழக்கம் இருக்கு. கோயில சின்ன பிள்ளைல கோயில கும்பிடுறதுல ஓமன் சொல்ற பழக்கம் இருக்கு. ஆனா இதை நான் ஆய்வு செய்து பார்த்திருக்கிறேன். பாக்கல எனக்கு கண்ணீர் வர்ற ஒரு பிரச்சனை வருதுன்னா நான் ஓமன் சொல்லி கொண்டு இருந்துருவேன். ஆனால் அந்த ஓமால சரியான சந்தோஷமாகி என்ன பிரச்சனை வருதோ அது இல்லாமலே டிலீட் பண்ணப்படுற இது வரும். அதனால ட்ரோமா
இருக்கிறாங்களுக்கு ஸ்டடிஸ் இருக்குது. சன்ஸ்கிரிட் வேதாங்க செய்து போட்டு அவையெல்லாம் அந்த மெஷா பண்ணி பிரீதிங் இதெல்லாம் பார்த்து அப்படி ஸ்டடிஸ் இருக்குது. அதனால இட்ஸ் வெல் நோன் ஒரு ஃபேக்ட். அது உண்மையா நீங்க சொல்றதுல அது சயின்டிபிக்காயும் ப்ரூவ் பண்ணப்பட்டிருக்குது.
ஒரு வேலை ஒரு வேலை செய்யும் போது எங்களுக்கு அந்த வேலையை செய்யறதுக்கு முதல் நல்ல ஸ்ட்ராங்கா அந்த வேலை முடிக்கணும்னு சொல்லிக்கல நான் இந்த ஓம நான் சொல்லி போட்டு நான் செய்யறேன்னா அது கிட்டத்தட்ட 2 days 24 hours நித்திரம் கொள்ளாமல் ஒரு வேலையை செய்து முடிக்கிற அளவு சக்தி தந்துடும். பட் அது பேரின்பம் கிடைக்கும் இதுல சொல்றவ எங்களோட சமயங்கள்ல எல்லாரும் சொல்லுவினோம். இப்படி சொன்ன திருவாசகம் படிச்ச பேரின்பமாகினோம், மாணிவாசகர் இப்படி பேரின்பமாகினார். ஓமுக்கு பெரிய இதே இருக்குது சைவ சமயத்துல. அப்ப அந்த ரகசியத்தை அதையும் இதையும் இந்த நரம்பு மண்டலத்தை வேகஸ் நர்வும் பராசிம்பத்தேட்டிக் மட்டும்தான் இதுக்கு ரெண்டுக்கும் தான் இந்த லிங்க் இருக்கின்றத கூறிக்கொண்டு உங்களோட சிறப்பான இது ட்ரோமா யார் இருந்தாலும், யாருக்கு ட்ரோமா இருந்தானா, ஸ்ட்ரெஸ் இருந்தானா, டிப்ரெஷன் இருந்தானா, டிமென்ஷியா இருந்தானா, இன்சோமியா இருந்தானா, இந்த டெக்னிக்கை இதை பிடிச்சால் அவ்வளோத்தையும் சுக்குநூறா கலைக்கலாம். ஒன்றும் இல்லாமல் சந்தோஷமான வாழ்க்கை வாழலாம். எனக்கு கணக்கு உங்களோட முழுமையான இதை நான் கேட்டு நான் ரசிச்சேன். மிகவும் சிறப்பாக இருந்தது. இதுக்கு மட்டும் உங்களோட கருத்தை மட்டும் சொல்லிட்டு நீங்க இந்த வேகஸ் படி 2-3 வசனம் திரும்பவும் சொல்லுங்கன்னு சொல்லிப்பட்டு நான் விட வருகிறேன். மிக்க நன்றி.
ஆமா அதான் சொன்னேன், வேகல் அந்த பொலிவேகல் தியரி அந்த புக்கை தான் நீங்க வாசிங்க. அந்த வேகல் நாங்கள் டீப் பிரீதிங் எடுக்கல, எங்க டயஃப்ரத்துல இருக்கிற அந்த வேகல் நர்வ் தான் ஸ்டிமுலேட் பண்ணப்படுது. வேகல் நர்வ் ஸ்டிமுலேட் பண்ணப்படையக்குள்ள தான் நாங்க காமா மிச்சம் நீங்க சொல்ற எல்லாம் நடக்குது. இப்ப நீங்க நித்திரையை பற்றி கதைக்கலாம், இப்ப நித்திரை பெறாதவை கூட நீங்கள் வேகல் நர்வ் ஸ்டிமுலேட் பண்ணிக்கல, உங்களோட பிரெயினும் காம் ஆகுது. அப்ப நீங்க இப்ப சில வழியில உண்மையில நான் அதை ப்ராக்டிக்கலா செய்யறேன். இப்ப நான் கணக்க இன்வால்வா இருக்கிறதுல படுக்க போகைக்குள்ள சில வழியில மூளை சரியா பஸ் பண்ணிக்கொண்டே இருக்கும். அப்ப அந்த நேரங்கள்ல நாங்கள் இப்படி டீப் பிரீதிங்க நாங்கள் எடுத்து கொண்டு வர தண்டை பாட்டுல கொஞ்சம் கொஞ்சமா காம் ஆக்கும். அதுக்கு பிறகு நீங்க நித்திர கொள்ளக்கூடியதா இருக்கும். அவ்வளவுதான் நான் சொல்ல முடியும். நேரத்தை கருதி நான் இன்னொரு நிகழ்ச்சியில நாங்கள் அதை தனியம் போட்டு பார்க்கலாம். நன்றி.
சத்தம் கேட்கல.
நாளைக்கு காலமே 9:30 AM எக்ஸசைஸ் செய்ய இருக்கிறோம். 11 o'clock மைண்ட்ஃபுல் லிவிங்கை பற்றி டாக்டர் சுரேஷ் குமார் பேச இருக்கிறார். இந்த நாளைக்கு இரவு 8 மணிக்கு டொரண்டோவில இருந்து பேச வருகிறார் டாக்டர் போல் ஜோசப். இப்படிக்கு உங்கள் அன்புள்ள கழுதை. இதே போல கிறிஸ்மஸ் டே 9:30க்கு சாங்ஸ், மியூசிக் அண்ட் டான்ஸ் எல்லாம் நடைபெறும். இந்த கேளுங்கள் கொடுக்கப்படும் என்ற தலைப்பில் குமாரசாமி பிள்ளை மாஸ்டர் 11 மணிக்கு UK டைமும் 10 PM சிட்னி டைம் பேச வருகிறார். இந்த 8 PM கிறிஸ்மஸ் டே ராதே மாஸ்டர் கிறிஸ்மஸை பற்றி பேச எவ்வளவுதான் நிகழ்ச்சி. இப்ப நீங்க பேசலாம் டாக்டர் ஜெகநாதன், நீங்க பேசுங்க.